We have a caller from New York on line 7 who denies it. Savita on WABC. Go ahead, make your point on the Savage Nation.
Savage, I am from India, an immigrant and a physician. And I do not agree with some of your points. Measles will spread wherever there are people exposed to each other. Immigrants have nothing to do with measles.
No, whoa. You just made a big leap in faith. Measles happens to be endemic in certain nations on the earth. Is that not correct, doctor?
Yes, but may I finish my point?
No, you may not. You may continue in a moment because you made a misstatement that was meant to mislead people. Is there a link between the measles outbreak and illegal immigration? I'm saying yes and you're saying no.
I am saying that measles in the state that apparently you're a resident of, where people are not even taking the vaccines that they're supposed to be getting, and you're implying that that your little baby has to have a vaccine because those illegal immigrants are bringing measles, is disingenuous.
Savita, when did the measles, the incidence of measles, increase in the United States of America? Do you know the answer to that?
To an illegal immigrant and get...
Savita, listen, now you're talking again. Don't talk down to me. I'm asking a question since we're having a rational discussion. When did the measles incidence in America, when did the incidence of measles in America increase? Do you happen to know the year?
No, I don't know the year. But it's your program, and you must have looked it up, and I don't have to know this.
But you made a blanket statement as though you had all the answers because you just said that immigrants have nothing to do with the measles epidemic, but you are wrong. Do you know that the enterovirus has a heavy presence in Central and South America? Are you surely aware of that as a doctor, aren't you?
Yes, I am. And enterovirus is common in many, many other tropical countries, including the country that I'm from. Yes, they are endemic. Look, third world is going to have more infectious diseases. There's no doubt about that. And
so why are we bringing in infected people from the third world? How does that benefit a nation to do that?
Okay, why does it? You are saying that I am no pro-Obama person, but for me to, going from one point to another to the third and somehow getting them all together and calling Obama the corrupt person.
Well, but now you're changing the subject. I caught you in a mistake, and now you're going back to Obama. I thought we were having a rational scientific discussion. You just admitted that the incidence of measles is higher in certain nations than others. I said, what sense does it make to bring in infected individuals to the United States of America? What's the answer to that?
Okay, you are saying that you said just now that Somalia, we have been getting 70,000 odd people every year for the last 30 years. I think during that time, Obama has not been the president all along. So what was...
I didn't say it was Obama. I said it started with Kennedy the drunk. That's what I said.
Calling people names does not...
He was a drunk. He was a well-known drunk.
But
What's wrong with calling a drunk a drunk? He lied to the American people. Long before you were in this country, we had a man named Edward Kennedy who was a liar and a drunk. And when he passed the Immigration Reform Act of 1965, he said that the immigrants that we will bring in will not affect America negatively, and we will not change the demographics of the country, and they will be perfectly fine and they will become assimilated. He lied about it. Why shouldn't I be outraged? Why shouldn't I point fingers at him?
May I say something?
Don't play the game like you're in a hospital ward playing the game with me. You've been saying an awful lot, and everything you said made no sense so far.
I am being polite. I'm not yelling. I'm saying, may I say something?
All right, so many people kill you with politeness. I get it. And many people who are angry are very good people, but they're not polite. And many people who are polite are very evil people. I've met them all my life. The polite ones are the ones who put a knife in your back.
Oh, so I am wrong at being polite?
How about the uptick in tuberculosis, HIV, hepatitis C, and tuberculosis? Where do you think it's coming from, Dr. Savita?
Okay. Where it's coming from is in the U.S. There are pockets, inner cities. There are places that people do not have access to health care, and they live in close quarters. HIV epidemic...
No. You're distorting reality. It is being imported from the third world. And the only way to reduce the incidence is to slam the doors shut and to start deporting infected individuals back to the hellholes they came from.
One point, if I may.
Oh, stop it. Please stop it. You're begging the question over and over again as though I'm a bad guy and you're a good girl. Please make your last point. Do me a favor.
See, you have a louder voice, and it's your show, granted. I should...
No, why don't you go get a radio show, Savita, where you can spread your lies? Why don't you do a nice, polite radio show on NPR? They'll listen to you, and you'll tell us that measles was endemic in America, that tuberculosis was endemic in America, and the immigrants had nothing to do with it. That's a total falsehood.
Play the tape again.
Tuberculosis was virtually eradicated in America until approximately the end of the Vietnam War, when we were flooded with Indo-Chinese who came here infected with tuberculosis. Are you aware of that?
Tuberculosis was endemic in China. But calling people names...
Again, you're going back to the wrong point. We are having a scientific discussion. You didn't hear a word I just said because you don't want to hear a word I say. Tuberculosis was virtually eradicated in the United States of America until the end of the Vietnam War. And then something happened. And that is the boat people were let into America, mainly Vietnamese and Cambodians, the Indo-Chinese, many of whom were infected with tuberculosis. Are you aware of that?
When should the border have been sealed? Because apparently...
Well, now you're changing the subject because you can't answer a single question. I can see how you got your way in the medical world. But you're not going to get your way with me, because I'm not one of these polite dunces that you've worked over your whole life in the medical world. Now, goodbye, and have a nice day, and I'll be right back.
Join the
Hour two of the Savage Nation. The first hour was about immigrants and epidemics because of the shocking new story that came out from Breitbart, by the way, based upon State Department of Health in Minnesota data, that 1 of every 5 refugees resettled in Minnesota by the illegitimate, fascistic, lying federal government tested positive for latent tuberculosis in 2014. That means 1 out of 5. And amongst those, 26% of all foreign-born cases of TB in Minnesota were from immigrants from Somalia. And Somalians almost exclusively enter the state through the Refugee Resettlement Program, which is a way of getting around immigration law itself. We are then looking at other diseases brought in by immigrants over the years. Popular radio talk show host Michael Savage, who you are listening to, who holds a doctorate in nutritional ethnomedicine, one of which the major within that is epidemiology, said this. I'm quoting myself now in an early article. The socialist government, media, academia, medical apparatchiks have looked the other way or changed the origin of numerous illnesses which were once eradicated in our once first world nation. Since the massive influx of illegal alien children from Central America who are not being medically screened, the United States has had outbreaks of numerous illnesses that were once eradicated, such as, take notes, doctors, dangerous strains of influenza, tuberculosis, measles, mumps, rubella, smallpox, leprosy, and even malaria. And yet these outbreaks have been covered up by the criminal Obama administration appointees at the CDC, all of whom are committing perjury and should be tried for perjury. Every day the Obama administration continues to violate federal immigration quarantine laws. Infectious diseases will continue to infect the general population, and children who are required to go to grammar schools, along with the illegal alien children from Central America. If you would like some examples, all of you who have your minds made up on this fine May day, numerous epidemics sweep Central America, and there is an aggressive mosquito that transmits the deadly enterovirus EVD68, and yellow fever, and some infectious diseases are transmitted by insects, including the new spread of dengue fever, which was once eliminated in America. But EVD68 was responsible for at least 14 deaths in the U.S. It also brought around the first cases of paralysis that we had seen in decades. I can read you the list about illegal aliens bringing in many infectious diseases into the United States, like measles, EVD68, dengue, flu, etc. I did. But the children themselves who are coming in are transporting mosquitoes that are carrying very dangerous infectious diseases in their clothing, Catholic Charities. The Obama administration continues to flout quarantine laws, in order to facilitate the massive illegal entry of illegal aliens through the southern border of the United States. This has created a public health hazard for your child enrolled in grammar schools and for the general public in communities throughout the United States. So the liar-in-chief gets up there at his college speech and talks about the elimination of diseases like polio while ignoring completely the diseases that have been that are resurgent in the country as a result of his criminal immigration policies. That was hour number one. And I have to now bring it back to how I started the hour on the Savage Nation. I started it by saying, look, I'm an immigrant son. And many of the things that are being said about this wave of immigrants into America were said about my grandfather when he first came here. I recognize it. So I ask myself, is this just nativism and racism, or is there something different about this wave of immigrants from the time that my grandfather came here? And it's not just my grandfather. It could have been Italians. It could have been Irish. They were all spat upon by the general population when they got here. But there was a huge difference at that time. You know what the difference was? All of you socialists out there, we did not have a welfare state. Now, the famous inscription on the Statue of Liberty says, give me you're tired, you're poor, and you're hungry, right? And we say, wow, see that? Even in 1904, we were looking to help people from around the world. That's a lie. First of all, there was no welfare state. Zero welfare state at that time, none. There were no food stamps, no government cheese, no welfare at all. The people came here, either they worked or they died. But more importantly, if they showed up at our borders at Ellis Island and they showed any sign of infectious disease, they were either sent back to their country of origin or they were put in quarantine until they were cured of that disease. Moreover, any immigrant coming into America had to show that they had a sponsor who could support them, because the government certainly wasn't going to support them. We had a legitimate government then. Now we have an invasive government that may as well be a third world government that has taken over this country to flood us with third worlders, to make us less like America and more like the hellholes around the world. And that's how 30 to 40 million Americans see this issue. I'm not the only one. If I was the only one, I wouldn't be on the radio. I wouldn't have lasted a day. But I started my career 22 years ago fundamentally talking about immigrants and epidemics. And it's gone up and down, it's waned and it's waxed, but now it's reached a new crescendo. Now, Donald Trump came along, and he achieved immense popularity by talking about building a wall with Mexico and about banning the immigration of Muslims into America until, quote, we can figure this thing out. Why do you think the average American responded to that? Is it because we are inherently bad people, inherently racist, inherently nativist? There may be elements of that. No, it's because we inherently have survival skills. We as people inherently know what is good for us. And we also can smell a rat when we see a rat, even if the rat's wearing clothing and a white collar. And many of us understand the danger he is putting us in on a daily basis, which again brings us back to the primary question, for which I don't think we're going to find an answer, which is, does he do this out of an altruistic desire to be a man who is good for the world and for his own country, or is he doing it for more nefarious reasons, primarily because he hates America and wants to do things to weaken it? That's a question that rages through the minds of millions of Americans.